What is anxiety? The National Alliance on Mental Illness, NAMI, defines anxiety as an excessive fear or worry that persists in situations that are not dangerous. Most people feel occasional anxiety. It's a standard part of life. According to NAMI, while occasional worry is normal, persistent anxiety lasting longer than 6 months may indicate an anxiety disorder which requires professional intervention. This is especially true when anxiety occurs without any significant life-changing events. When anxiety becomes chronic, it can interfere with your ability to function in your daily life and lowers your overall quality of life as a result. It commonly leads to avoidance behaviors and physical symptoms such as rapid breathing, shortness of breath, an elevated heart rate, and muscle tension, just to name a few. Anxiety doesn't just impact the individual's mental and physical health, but also their communities and workplaces. In addition, anxiety significantly burdens the healthcare system and increases risks for acquiring other mental health conditions. The yearly cost of treating anxiety disorders is estimated at $42.3 to $46.6 billion, with over 75% of the cost attributed to morbidity, mortality, and lost productivity. In addition, the medications used to treat anxiety accounts for 53% of all mental health drug costs in the U.S. There are 4 main types of anxiety disorders, and they fall into the following categories. 1. General anxiety disorder, GAD, is a condition where a person worries a lot about everyday things, like school, friends, or family. These worries can be really strong and hard to stop, making it difficult for them to do their regular activities. 2. Panic disorder causes a person to have sudden and strong feelings of fear, called panic attacks. These attacks happen often and come out of nowhere, making the person feel very scared. They may also feel physical signs like a fast heartbeat or trouble breathing. 3. Social anxiety occurs when a person feels really nervous and scared about being around other people. They worry a lot about what others might think or say about them. This can make it hard for them to go to places where there are a lot of people, like parties, picnics, or other social events. People with social anxiety often feel very shy and worried, making it tough to enjoy being with others. 4. Phobia-related disorders involve an irrational fear of a specific thing. These can include agoraphobia, leaving home, acrophobia, heights, or claustrophobia, closed spaces. Risk factors for anxiety. Certain factors increase the likelihood of developing an anxiety disorder. Family history of anxiety disorders, intimate partner violence, childhood abuse, post-traumatic stress disorder, PTSD, health problems, chronic pain, heart problems, asthma, thyroid disorders, etc. Substance use disorder, SUD. Myths about anxiety. Mental health myths and stigmas often complicate treatment for anxiety and related disorders. These misconceptions hinder or prolong the recovery process. Myth 1. Anxiety is an overreaction to stress. Fact. Anxiety is a mental health condition that most often requires treatment. Treatment can include medication and therapy. Myth 2. People with anxiety are drama queens/kings. Fact. As mentioned above, anxiety is an autonomic or involuntary response to stress, and it cannot simply be willed away or overcome with willpower. Effective treatment for anxiety may include medication, therapy, and often lifestyle changes. These approaches can help individuals identify and avoid situations that trigger anxiety. Myth 3. Those with anxiety are mentally weak. Fact. Anxiety is not a mental weakness or character flaw. It is a legitimate mental health condition that requires treatment, which may include medication and therapy. This myth contributes significantly to the stigma surrounding mental health, often preventing individuals from seeking the help they need. Myth 4. You can clearly spot and identify someone suffering from anxiety. Fact. Often, anxiety happens abruptly, and the person could have been very calm and unaffected moments before and is now experiencing heightened anxiety. Simply because a person appears calm, cool, and collected does not mean the person is not severely struggling inside. Top 10 things you should know about anxiety. 1. 23.5% of U.S. women and 14.3% of U.S. men suffer from an anxiety disorder. Yet 17% of those with substance use disorders, SUDs, also meet the criteria for having an anxiety disorders. 56% of individuals with eating disorders also have a diagnosed anxiety disorders. 4. Anxiety disorders are highly treatable, but only 36.9% of those with this condition seek or get treatment. Individuals with anxiety disorders are 3 to 5 times more likely to visit a doctor for physical complaints and 6 times more likely to be hospitalized for mental health issues compared to those without anxiety. The vague and subjective nature of these complaints can make it difficult for physicians to diagnose anxiety. Additionally, many patients may hesitate to discuss their mental health concerns for fear of being stigmatized. Yet 6. People with high anxiety levels are nearly twice as likely to experience work-related injuries. This costs organizations billions of dollars each year, with 88% attributed to loss or reduced productivity. 7. 71% of the female workforce and 54% of the male workforce report experiencing workplace anxiety. This is a large contributor to job dissatisfaction. Today, half of people diagnosed with anxiety are also diagnosed with depression. 9. Approximately 31% of Americans will experience anxiety at some point in their lives. 10. Anxiety disorders are the most common mental illness in the U.S. for those age 18 and older. Treating anxiety therapy, medication, and lifestyle changes are considered the gold standard treatment for those with anxiety. Along with treatments like medication and therapy, you can try other coping techniques for anxiety. While many of the coping techniques mentioned below are helpful, they don't address the underlying cause of anxiety, and they may not be enough to treat or eradicate anxiety. These techniques are most effective when combined with professional treatment and therapy, and can be particularly useful if you are between therapy session or you choose not to or can't take medication. Here are some of the most popular. 1. Take a time out. Remove yourself from the situation and do something different, like listening to your favorite music or doing some stretching. 2. Minimize alcohol and caffeine intake. Both alcohol and caffeine can make anxiety worse and cause mood shifts. 3. Laugh more. Studies show that laughing improves mood and decreases anxiety. 4. Eat more balanced, healthier meals. This prevents spikes in your blood sugar, which prevents energy crashes and mood swings. 5. Try mindfulness. Mindfulness involves focusing on the present moment and the feelings passing through you. 6. Deep breathing. This triggers the parasympathetic nervous system, which can help you to relax. 7. Try to get 7 to 9 hours of sleep each night. Adequate sleep decreases the hormone cortisol, which is responsible for our fight or flight response. 8. Meditate. Practice meditation to calm and recenter your body and mind. This activity could include breathwork and mindfulness, but not always. 9. Choose anxiety-reducing activities such as Tai Chi or yoga. These exercises help by increasing body awareness, improves pain, and improves mood. 10. Ease physical tension. Consider trying massage or acupuncture to address the physical tension anxiety creates in your body. According to the Anxiety and Depression Association of America, there are a variety of types of therapy that can be helpful for dealing with anxiety. Include Cognitive Behavioral Therapy, CBT. CBT focuses on identifying, understanding, and changing thought and behavior patterns. Exposure therapy. In exposure therapy, you will be slowly exposed to a feared situation to help the fear response diminish over time. Acceptance and Commitment Therapy, ACT. This type of therapy uses strategies of living in the moment and refraining from judgment, along with behavior change, to cope with anxiety. Dialectical Behavioral Therapy, DBT. DBT combines CBT techniques with meditation concepts. Interpersonal Therapy. This is short-term supportive talk therapy that focuses on resolving interpersonal or relational problems. Eye movement desensitization and reprocessing, EMDR. EMDR uses bilateral stimulation through eye movements, tapping, or tones to help heal from past experiences. Strategies for identifying and quantifying your anxiety. Individuals with anxiety must proactively address their condition to improve well-being, productivity, and health outcomes more effectively. The following are helpful alone or in addition to professional therapy and medication. Also, if you have never actually been diagnosed by a physician as having anxiety, these tools can help you better document and explain your symptoms and difficulties. This can allow the physician to more accurately diagnose and treat your symptoms. Following are some actionable strategies. Item 1. Use an anxiety rating tool. Using a simple tool to assess your anxiety can be empowering. It allows you to quantify the severity of your anxiety. It also allows you to identify potential triggers early and implement targeted interventions. 2. Use an anxiety mapping tool. The use of a mapping tool can be a game changer. An anxiety map helps you understand your condition before it becomes overwhelming and critical. It allows you to identify your triggers and recognize the strategies you need to manage potential panic attacks. Mapping tools are effective because they let you plan ahead. So when anxiety strikes, you can focus on implementing pre-planned calming techniques that work best for you. 3. Journaling is a powerful tool for managing anxiety. It helps you pinpoint the events that may be triggering your anxiety by providing a clear, time-stamped record of your experiences. By tracking your thoughts and emotions over time, you can identify patterns, gain insight into your triggers, and make informed choices to avoid or better manage anxiety-inducing situations. 4. Seek support. Find at least one person you can trust and depend on. Share the results of your mapping and journal outcomes so that they can be aware of the help you need if you run into a crisis. Conclusion. It doesn't matter if you choose to use the information from this video or seek advice from your therapist or other professional. What truly matters is that you take action to manage your anxiety. Right now, make the decision to break free from the fear your anxiety has you chained in. Identify specific resources that resonate with you, whether it's books, online tools, or support groups. Set small, achievable goals for yourself each day to gradually gain control over your anxiety. Reach out to someone who understands, whether it's a friend or professional. You are not alone in this journey. Remember, you deserve a better quality of life. You can't begin to feel better unless you take that first step. Every little action counts, and with each step, you're moving closer to a more empowered future. You've got this. Thank you for watching our video. To get the most out to the information provided in this video, please download the information sheet that gives more information on this topic. Also, don't forget to download the 4 Ps of Wellness Worksheets so that you can determine your holistic wellness. Remember, we upload a new video every Monday. Every Thursday at 7 p.m., we come to you live to go over the information and to answer questions about Monday's video. See you on Thursday.